and welcome to Manned Up Conversations, where we connect with evolving men to discuss issues around masculinity and manhood, and also provide tools to help us be better for our society.
People should not wake up one day and say, for the first time, I must get checked.
Sure.
You must get checked throughout. From the time that people go for vaccines as a baby, usually the nurses will examine them, the GPs would have examined you, and now once you are old enough to can get going yourself, there must be routine checkups of things like sugar, diabetes, blood pressures, cholesterol, etc., etc. Eventually, that will move to highly specialized invasive checkups at certain ages. For example, we don't want to start realizing for the first time when the child is already older that they don't have testicles or nuts, gonads in the scrotum. Because you need to bring them down by 18 months of age. Otherwise, even though you bring them down a bit later, they may struggle with infertility. The window is missed. You've taken them down, but now you've got an infertile child who cannot bear kids just because somebody didn't check.
Welcome to the show, another installment of Manned Up Conversations. I'm here with a man with a very interesting surname. We actually had some chats about it. I actually thought my brother here is from Nigeria, but it turns out he's a Tswana man like myself. Dr. Ijane. How are you doing, sir?
I'm good, thanks. And yourself?
No, I can't complain, huh?
Yeah.
Thank you for welcoming us into your beautiful space. And much thanks to Lena for sorting us out. I also can't quite say your surname, so I'm just going to leave that out of it. But we're dealing with people who've made history, man, in the country. Dr. Ijane is the first black robotic surgeon. I mean, what does that even mean? Like, I'm thinking about it. I'm trying to wrap my head around it. Can you simplify it for an average man like myself?
Okay, no, it's a pleasure to be here with you. Robotics it's just a machine that we use to perform the operation with.
Sure.
Using what they traditionally would have said is minimum invasive surgery. You use little sticks to do the op.
Sure.
Now, when you're doing it with the robot, the sticks are kind of like the extension of the arms of the robot, and you make small little holes to place them inside the patient's, usually the tummy, and then you control the machine performing the operation while seated nicely, comfortably in a corner. And yeah, that's what robotics are.
Wow.
So it's kind of like it's the next phase of what would have been laparoscopic surgery, which means operation using sticks, minimum invasive surgery. Yeah, that's what it is. Yes.
Now you've dropped a lot of big words.
Big words, jargon.
So, it's very and I think that's what happens when we come to a professional.
Yes.
And people are thinking, okay, I need to go get help for, I have issues with my guy downstairs, or with my legs or whatever. You know? But the first place I'd go to is obviously to go look at a journal, read something, and then
Google.
I'll be like, and it's like, let me Google this. I'm sure if I Google it, I'll get something.
Yes.
So do you think that stigmatizes or keeps people away from coming out and seeking help?
Yeah, I think the problem with medicine is that it's full of jargon.
Sure.
To try to break it down into simple colloquial language is a very difficult skill.
Okay.
And to try to measure that with expectation, bearing in mind that there is also varying level of literacy.
Yes.
So you might be speaking to somebody who's your colleague, or you might be speaking to somebody who never even made it through matric. And then you have to try to convert whatever this jargon is to vernacular.
Sure.
That becomes very, very difficult. But equally, I think for men, it's just fear of the unknown. More often than not, the guys come to the hospital, and then when you tell them, say, this is the problem I find, they're like, yeah, I was never sick until I came to you. so they are afraid to come and find out what's happening.
Okay.
But to just demystify the jargon, I mean, in the past, when you do operations, you took a knife and you made a cut as big as it is necessary to complete the operation. That leaves a person with a wound.
Yeah.
Now you can imagine if you've got a small wound, versus when you've got a big wound, the pain scale is not the same, the length of recovery is not the same. When we do robotics and laparoscopy, we try to make a small little cut to perform a major surgery so that you can heal quickly, you can get out of the hospital quickly. I don't think that's the reason why people are afraid to consult. I think it's just not wanting to find out what might be happening inside of you, which unfortunately doesn't change the fact that it is happening regardless of whether you want to come or not. That if you've got sugar diabetes and you don't want to have your sugar tested, or if you are HIV positive and you do not want to do the test, it does not mean therefore you don't have the disease. It just means you don't know. And therefore you are not able to take precautions and take necessary steps to be okay.
So, I mean, you dealing with this stuff now, and you're getting, I'm sure I saw your desk today and it was full of a bunch of stuff. So I'm sure you saw X amount of clients, right?
Yes.
But how do they even get to a point to say, well, okay, no, I think, no, this is a problem now. Okay. And the other interesting research or stuff that I've read online speaks to men, or we don't come to look for help when something is, still at like its beginning stages.
Yes.
We always wait for the wound to become this huge thing, and then like, within a month I'm like almost dead.
Yes.
So let me go look for help. So how do you find that all working for you?
Look, where I'm working, I'm kind of like a little bit far down the line of referral. So traditionally, people will either start with their local clinic or their local general practitioner, family doctor. It might be that they're seen by another specialist, and then they identify something that might need a urologist attention. In an ideal world, everyone should be coming via referral after being screened before. Otherwise, you get a lot of people who come and then you find that they started at a level where somebody will come with a lower backache and say it's a kidney problem, or will come with a lower abdominal pain and say it is their bladder, when it's something else, sometimes just the muscles, the bone. It is still better than not consulting. So an ideal patient is the one who's been seen either by their general practitioners. Some tests have been done and they are trained enough to identify where you need to go for the next level, so that we can offer that specialist services. In as far as men staying and not coming, I don't think there's one reason for it, but part of it is just information, lack of information and understanding why you need to be checked, why is it necessary, and when should it be done, as opposed to the resistance that I don't want to go see the doctor because I'm kind of like macho and crying is weak. There could be some fewer cases like that, but I honestly don't think I'm noticing that lately. What we're seeing is just people not knowing. You see somebody who has had medical aid for very long, and right at the end of their retirement, they only find out for the first time that they've got a dreaded disease, and they could have attended to it earlier. So the more you spread the information and make people aware, the more they respond and come for checkups. So I think information is key, as opposed to stigma and categorizing and putting people in little clusters. So that's how I see it.
Okay. So you speak to referrals now. So let's say I go to a GP and for some reason, hey, this guy, I get a misdiagnosis, or you were saying, or it's an abdominal pain, and it's nothing to do with kidneys, or it's nothing to do with the heart, whatever, in the anatomy is wrong. So what happens in those cases? Do you ever get a referral wrong from a certain doctor?
I wouldn't call it wrong. I mean, we kind of like a family of medicine is interlinked. So it's best that if you're not sure what next with the patient, pass them on to somebody to just get a second opinion, have a look at that. So patients, sometimes come with a referral that this is what I've done for this gentleman or this lady, and I'm not sure how to proceed further anymore. It might also happen that when I look at it, realize, I've met that end, I'm not quite sure. But generally, you go through rules of elimination. Where's your pain, or what's your complaint? What else could it be? Go to specialized investigations, which is where the advantage of being in a hospital setting is, because the GP does not have easy access to things like MRI, CT scanning. They can order them, but the patient must then travel further to some place to get it done. And sometimes the medical aid wants to know why is it being ordered. Where else, if it's ordered by the specialist, usually they are more agreeable to paying for the investigations. and it still helped to pick up a patient. And sometimes they've got multiple pathologies, multiple illnesses, and then you can also channel them to the right guy. So it's always a multidisciplinary, and it's both an upward and a downward referral. Some patients, after being helped, they are better served by going back to their local doctor to continue their follow-ups. Others are better served by keeping them until a point and managing them in a multidisciplinary team. So it's just an evolving way, and I think there's no hard and fast rules about it. Yeah.
Oh, I love that, man. So now, I'll speak for myself. The last time I had something happen around my parts, I was getting circumcised.
So, guys, now you know. So, he's the man.
And we just put it out there. But I'm saying that because we actually had a chat with my friend on our way here.
Yes.
And we were saying his father is actually someone who's going through treatment for prostate cancer, right? Okay. So then it's like, oh, well, you never really knew or heard from your father. You never got any kind of messages around, sexual health, if I may put it like that. So then if, like myself,
okay.
So that conversation is also like, I can't go to my mom now and say, hey, I've got, issues down there.
Yes.
So do you ever get people who come to you just out of nowhere with no referrals? Oh no, I saw you at Urology Hospital.
Yes, no.
Okay, Dr. Ijane.
No, it happens a lot. The walk-ins, there's a lot of those. Others just call the hospitals through maybe Googling, word of mouth, or however they may have known about the hospital. Others refer themselves from other hospitals because they want second opinion. And that happens both locally throughout the SADC region, and occasionally even outside SADC, where a patient will just arrive fully worked up with their x-rays and say, have a look. Others totally unworked up saying, I was told that you once helped this person, so here am I. Okay. Can you also assist me? And then we'll take a look. We don't necessarily turn them away. We still do offer advice, and then if it's within the urological parameters, we offer assistance where it's possible. Otherwise, we then refer them to the right people. So in as far as talking and everything, I'll always flip back to awareness.
Sure.
I think in many instances, you also equally get mothers who are really having a very open conversations with their boys. And a simple example is with circumcisions, the op that you did. So, you said it. So, what happens is that between May and July every year, we get lots of cases that are coming for circumcision because of still the fixated belief that it has to be in winter.
Sure.
Where else that could also be done in December, but in the community's mind, this is a thing for winter.
Yeah.
December, it doesn't happen. They have to be in winter. Oh, okay. But equally, most of them are brought by their mothers.
Yeah.
And a large percentage of boys are also brought for consult by their mothers, concerned about the sizes of their manhood. It's very rare to see a father bring a child and say, check my child's guara. I think it's below average. Usually it's the moms and the grandmoms. So it shows you that where people know where to go.
Sure.
And even if they're not sure how to do it, they will still try because there's a pathway. Where can I get help? But equally, it's I don't think anybody grows in an island.
Sure.
They are family members. Unfortunately, for reasons that I could not even all answer, some people, we will not use all the resources. There are uncles, there are aunts, there's mamas outie. There are people who can help. Then they can chat and then advise on some of the things. What is important is to just have that relationship with your kid, especially if you are female and you are raising a boy child. You can't wait when they are much older and say, now let's go for it.
Sure.
I mean, a typical example I had was a child that we did a secam on, and mama thought that the last time she checked his manhood, it was not growing well. Wow. Now, around puberty, she thought, okay, let me see. And the young man is now around puberty. They don't drop the pants and show their mamas. It's just normal. And don't force them to.
Yeah, please, mom. Keep that.
Doctor said you must drop the pants. So they come with this child to consult. And now mom is sitting there. She tell me the story. I look at the young man. He's sitting there very cool and comfortable. And I ask him, issues? And then he just boldly shakes the head like, I've got no issues down there.
Sure.
So I'm like, oh, okay, let me take a peep so mommy can be happy. So I look down and I kind of like agree with him.
Sure.
So I tell mommy, you don't have to worry. There's nothing wrong down there.
Wow.
And that was the consult. Bye-bye. But she was comfortable. Yeah.
Sure.
So you don't have to try to sit down, be creative in explaining things that you cannot. Even go to the GP, go to the nurse. Ask them to assist you with the talk. I'm here to consult, chat with these boys about sexuality, and then sit there and they will assist you. That breaks the ice, and then eventually people can communicate about it. I don't think we should sit there helpless saying, Papa ran away. Sometimes he didn't run away, he passed on. Sometimes he did run away. Sometimes there are other reasons why he's not involved, but that shouldn't be a reason why some discussions cannot be had.
Sure.
Yeah.
Wow, I love it. So no, we're now going into that the stage where there's a lot of us now who are unsure of when to get checked.
Yes.
And the causes of all of these diseases down there. So what can you say that the cause has been? Because largely now, we were speaking with Levo a bit earlier, that there's a large number of men now who are suffering with prostate cancer. What would you say has been the uprise in all of this?
I wouldn't say, I think we are becoming more aware of it. In the past, there was a lot of mystic beliefs around illnesses. So when somebody had a swollen private part, maybe the hydrosil, meaning water accumulated around, they'll call it mokabi, suggesting something is blocked. That's why the water is building up there. Some they'll call it boswagadi. But if you listen to what they used to describe as those things, you can immediately correlate it, because they'll tell you boswagadi is smelly, and when you start seeing flies coming out of there, you must know the guy is going. Medically speaking, it means that area is rotten, as diseases like Phonias gangrene. And then they will have things like swelling of the groins, and they'll tell you, I mean, this guy, things like that. You could see the swelling, you could hear the sounds of the bowel, and then he started vomiting green and yellow stuff, and we knew he's going. Most of us, if you try to go back a couple of decades, you'll realize that was the firm belief. It still holds, and I'm not casting any aspersion to other ways of doing things, but people should not wake up one day and say, for the first time, I must get checked.
Sure.
You must get checked throughout. From the time that people go for vaccines as a baby, usually the nurses will examine them, the GPs would have examined you. And now once you are old enough to can get going yourself, there must be routine checkups of things like sugar diabetes, blood pressures, cholesterols, etc., etc. Eventually, that will move to highly specialized invasive checkups at certain ages. For example, we don't want to start realizing for the first time when the child is already older that they don't have testicles or gonads in the scrotum. Because you need to bring them down by 18 months of age. Otherwise, even though you bring them down a bit later, they may struggle with infertility. The window is missed. You've taken them down, but now you've got an infertile child who cannot bear kids just because somebody didn't check. Things like an inguinal hernia, which means swelling and ballooning of the groins, similar to the bullfrog blowing its neck. So if you have any swelling like that, you get checked. That might need an operation. And the reason for that means it's a hole. And the bowel and the intestine are poking out and ballooning like that. If they get stuck there, this is an absolute emergency. And if it's not attended to properly, you may lose your life. Growing older, most will be circumcising. There are lots of community programs, Brothers for Life, government programs, Right to Care, and whoever else is running circumcision programs. Part and parcel of that should also include just checking the boys. So the early ages must be covered like that. Once we start growing older, the next important thing long before that is just sharing information. The older guys in the family must disclose known diseases within families. If we know that in our family there is such a cancer, be it prostate, breast, or whatever, pass it on to the other people so that they know, and they can Google. Nowadays information is available. But specifically to checking for prostate diseases, and why is it so common? I think it's because many organizations, including independent, the South African National Cancer Associations and others, push the drive. We also had our at Urology Hospital a prostate drive the other time where people could walk in and get tested.
Yeah.
That testing itself mirrors what happened in the developed world many years ago in the early 90s, where the testing blood started to become available. You diagnose a lot of the disease, and then at a later stage, you think that it is declining. Where else, what was happening was just to really define the incidence in the community. So what we see is people becoming aware and getting checked, and we are starting to pick and mapping how common is this disease amongst us. Research has been done to look at the genetics, hereditary, and with that, it appears as if, wow, there's all these many diseases.
And they've always been there.
Part of it could also be contributed to our diet and our habits. Because when we get urbanized, we know from old studies that the Asians, when they moved to the US and they moved away from rice and fish and went to McDonald's and etc. Nothing against McDonald's, but burger and fast foods rather, before McDonald's come hard on us, burgers and fast foods. And when they went for all that, their incidence of prostate cancers increased. And therefore, the more and more, after 94, thanks to the ANC, we have prostate cancer. Because now most Africans and other communities who were otherwise not able to afford, they can afford all this junk. And therefore, the disease will manifest more. And the more we become more urbanized and pick up all this other disease with all this urban migration, the more these diseases are going to manifest. So that's probably what's still happening now in South Africa. Whether it's going to plateau sometimes, we don't know. It's something that is still evolving. 40 is an ideal time to get checked, a full checkup for a young African man. For their prostate evaluation, that will of course include the general urological checkup, and then your risk will be provided by your doctor who's assessing you. They will then advise you if you need to follow up either 2 yearly, 5 yearly, but from the age of 50, we prefer about 1 yearly to 2 yearly, depending on your risk. Yeah.
So I know you said a lot there, man. I mean, we're talking food, we're talking unhealthy lifestyles. The chisanyama.
Yeah,
so
chisanyama
now be saving us kadi salad. Scopo kika fish nyana kusaiting just for some healthy.
Yes.
But here's an interesting thing now. You know, I'm a cyclist, right?
Yeah.
So out am I bicycle? I don't even know what you call
your groin.
Your groin area.
And the nuts are sitting there.
It's taking quite a lot of strain.
You are crushing the eggs.
But also, it's a form of exercise.
It is.
So what is there any danger in that?
No, not really. Just get the right seat. Stop sitting on a hard thing that's kind of like a wooden stuff is poking your bum. Because you're gonna arrive there with very sore skins. So it's very good advice to just make sure that if you're taking on something like that and you're doing long distance, get advice, get professional help. They will measure your height, check what seat it should be for you, how high that should be set for you so that you're in a comfortable position. Because what causes pain is not necessarily cycling. It's just being in an odd position for long, thinking you are doing something right. That's why for driving, we take you through all the courses. For bicycle, we just jump on it and say, now I'm a cyclist. Meanwhile, come on, there is all this pressure that is sitting and waggling your perineum within the thighs. So, but I don't think per se, it's good for everyone to do cardiovascular exercises. If there is only one exercise that we have to choose, it must be cardiovascular. Lifting weights and all that makes you look a very good specimen, but you can still be a good looking and healthy specimen. So you'll rather be an ugly looking fit person.
Than all big muscle.
And if you want to check the Comrade Marathon runners, some of those guys and girls are big, they are huge, but they do that 90Ks. And you see somebody with 16 packs who can't even complete a nice 5-meter walk, they're out of breath. Because longevity is from circulation, cardiovascular systems. So that's the most important part. So keep cycling.
What are the best exercises? I don't know now. You know,
urological Kegels. They say they're good. Just Google Kegels exercises for men. They also exist. Apparently, they are quite good for sexual performance, which is what you hear a lot men confirming about. So a bit of Kegel exercise, less beer, less cigarette, and more exercises, and you go the mile.
Okay. And let's now talk about going the mile now. So erectile dysfunction and all of that stuff.
Go to men's clinic. I'm not their agent. I'm not marketing them, but they fill up a very good gap. it is a very sensitive issue, but more often than not, it's really a perception. If you ask an average person how long do they think the so-called round, a sexual round should last, you're going to hear stories. On average, International Sexual Society says about 3 minutes. That's all. Yeah. But because it's so intense, people think they've been at it for 30 minutes, unfortunately. So now you see people coming and say, I used to do 5 rounds a night. Now I'm doing 3. Like, come to me when you are doing no round in a week. I mean, if you're still doing 3, so it's perception, and pressure. The other time people come and say, I've got issues, when really they've got a relationship problem. So it's very important to identify what is the problem. If you are going down and under, you are being blacklisted. If you've gone wrong, you've put your hand in a cookie jar and you cannot sleep because the hawks are onto you. Obviously, don't expect miracles in the bedroom. Sexuality is just a reflection of your general state of mind and body. And there are, of course, incidences where you really are sick. And we would rather see those guys. The other ones need lawyers and psychologists. They don't need the doctors. And then things like sugar diabetes, high blood pressure, cholesterol, including aging, excessive drinking, drugs, and all that, they kind of like can affect circulation. And it will take us back to what we discussed earlier. Circulation, cardiovascular diseases. Because an erection is just blood circulation. There must be something that excites you. You must like being excited. And then your body must be able to provide circulation. That combination will take you along straight. A lot of young men will come and say, hey, doc, now this and this, it's not happening. I come quickly. Premature ejaculation, which is also a bit of a problem of sexuality, and it's very complex. We break that one into what we call lifelong and situational. So somebody might have premature ejaculation sometimes, others will have it all the times. Now, the person who have it sometimes, the question is that what is that bring it to come sometimes? And usually stressors, including excessive drinking, they all contribute to that. So it's sometimes need couple therapy. So to sneak around alone and complain about sexual dysfunctions, and you have to take tablets home and you have to hide them from the wife or the girlfriend or the partner, you realize that you're already stressed. Because there's a little secret you are keeping. You're trying to pop this pill in a corner and you are surprised it didn't work. Because you are supposed to have foreplay and interaction. Now that stress just make it fail. Because, so openness. And then just honesty. Well, guys, we have this problem. Let's go seek for help. Help is out there. And if everything else fail, I usually tell them you've got 10 fingers and a tongue. So use one.
Make a plan.
Make a plan. Get the job done with something. And then, of course, once those are passed, then it's easier to then isolate where are the real problems. And then with the real problems, which is true, some people really will have erectile dysfunctions. And we need to make sure that the body weight is well. You live a healthy lifestyle. There are no substances. You do cardiovasculars, and then of course we can try tablets, we can try injections, and right at the end we can give you something called a prosthesis, which means a little silicone plastic penis. With a little pump somewhere. You pump it up, it's standing up, and the spouse can work.
What does that go inside your penis? How does that now?
It's like little 2 cylinders looking like missiles. So we kind of like drill holes into the penis. The penis is like think of 3 columns and 3 cylinders next to each other. And then we just put those things into those little cylinders. When you pump them, they inflate with a liquid and it's standing. Until somebody deflates it. So usually the partners would love to know how to pump it on and pump it on. But there is help. There is help out there. Help does not necessarily mean your problem might be solved immediately. By saying there is help, it doesn't mean you knock in at the door, you say, now I've seen a specialist, all my problems are gone. No. We have to go through a series of interviews, assessments, blood tests, assess the relationship, because all what some people do is to maybe just get out of the relationship.
Maybe that's what the problem is.
I'm not necessarily saying that's what people should do, but if that is the problem, you need a pastor, you need a counselor, you don't need a urologist. And if that fails, life is too short. You need to accept that this is not working. Yeah, that's the reality. Sure. It's not erectile dysfunction, it's the marital or relationship problems. If your problem is the booze, stop the booze or choose the booze and forget about the erection. You can have both.
I mean, is there such a thing now as like optimal health, optimal weight? So at a certain age, I must
not really. BMI. Just I mean, if any of us can just Google what's your height, and then you'll get an advice of what will be your optimal body mass index. And it's a range. It's not a fixed value. It's a range. And then you try to live as close to that as possible. Of course, it's not always possible. There are people with serious problems that lead to obesity, and it become a problem especially when it's in younger children. So it's work in progress. So we must be sensitive about it because other people are really trying, but we must also be truthful when people are using it as an escape. You are body shaming me because I'm obese, and they are not applying any effort. So I usually say, okay, it's fine. What can we do? Let's try to get counseling. They get pissed. Are you saying I'm mad now? I'm like, no, I'm trying to help us have a conversation without getting too emotional or feeling judged. So choice of words is important. Timing is important. And of course, I'm not advocating any body shaming, but I do support that you have to start somewhere. One thing that doesn't work is people waking up one day and say, I'm going to lose 15 kilograms in a year. And then you feel like you have failed. Just adopt a healthier lifestyle. And if you don't know what that means, check a dietitian, Google, check other stuff. There's a lot of stuff there. Most of it will advise you, and most of it is helpful. Even though it might not be scientific, it is generally good advice. So stuff like that can help a lot. So people should just work towards that and see how it goes.
Need to inform ourselves, man. So I want to ask, like, the last kind of thing. Now, there's a guy listening to this right now, like, hey, Mona, there's so many things I have to do, try, whatever. You know? And like, maybe I'm just going to Google some stuff and, like I said, misguided. It's a bit too much for me. So what are the, like, 3 simple things that I can do to be like, okay, more, what do I have to feel my balls? Is there a certain technique to do it?
Yes. Generally, 3 things is tough to just summarize it in that because there's a lot of things. But the simple one first is just be true to yourself. You know where you're taking corners in everything else. You are the first person to know. Secondly is that there are people around you. And they usually will give you a good advice about what things are happening. So be a good listener. Be open to negative comments if they are meant to help you. What you may perceive as a negative comment, if it comes from the person who really, you also know that they generally caring and they trying to get that solved. So, for example, somebody might have an issue of over drinking, for example, and every time they tell you you're over drinking, the first thing is to defend instead of re-evaluating what do they really mean. So that's the most important thing. So be open-minded, be true to yourself. And then when it's coming to yourself, self-examination is always very difficult for people to say, how do I do that? What self-examination is, it's just you getting used to how does your body and your body parts feel like? So, for example, touching your nuts, touching your down and under the testicles and examining them just means getting used to, this is how they feel. Next time there is something that has not been there, then you will know. And if you are just starting and you don't know, is this supposed to be there? Because I've just started now. Seek help. Just pop in. You don't even need to see a specialist. Pop in with your GP. Tell them, I was trying to examine myself. I don't know if this thing should be there. They will be able to tell you, this is normal. This is supposed to be there. Now you know. Because unlike women are very relaxed with each other. They can actually examine each other's breast. I wonder when will the day come where men will examine each other's nuts. Hey, dude, can you just check here? Is this supposed to be there?
You see, and it's such a crazy one. Look at there's something that I learned this weekend where every time men get shamed or embarrassed about something, it turns quickly into jokes. Right?
Yes, that's the whole point.
Sure.
That's exactly where it's gonna go. They're gonna call you names, they're gonna call you all that, but it's quite easy if you just go to your medical professional. They examine you. Nowadays, they even have nurse-run clinics, which are quite affordable. Somebody can just pop there. They'll examine you, and if they are concerned, they will pass you on. But now you've got the frame from which you're working. And now what you do, doesn't have to be every day. Once in a while, just check there. Is this still the way I'm used to? That's all right. And if you find something that you're not sure about, you seek help. But for detailed evaluations from the age of 40, at least do visit a doctor for a full consultation and assessment. And then a normal general practitioner in their rooms can do that detailed examination, really. They are trained to do it. And when they pick some things, they'll pass you on. If they're not sure, they will then refer. Because at the specialist level, we are happier finding a referred, worked out patient. Just makes my work more interesting. I don't like starting at the family level because there's family practitioners who are supposed to be doing all that for us.
So now there's a trend now of that you see on social media.
Oh yeah.
Now everyone is busy with this thing, and like we were saying now, because the standard is 3 minutes, because we want to 3 hours, we want to damage everything. Now we want to be a king in the bedroom. So is there a downfall to that? And is there food that we can eat as guys that can, help things out down there?
No, I don't think all the foods that you see written up in Google have been scientifically proven to work. But what I like about all that, if you really look at those are healthy foods. So for that, I'll tell you, go for it. Not because they're going to make you some Don Juan de Marco, the greatest lover of all time. But they kind of like healthy stuff. So I would never go against anything that is healthy. So if they tell you eat peanuts, eat watermelon, do whatever, go for it. That's healthy stuff. When it comes to moringa, mbeso, bang, honeywood, goatweed, coffee, whatever, a la carte, there's a lot of stuff available in the market. The problem for people who otherwise don't have a problem and now go to take something, you kind of like also reset the tempo. To tell the truth, I think people put so much emphasis on how long they last. But if you just ask the partners or whoever it is that they're with, usually you'll get a pretty good idea of what is it that they want. I think everyone wants their orgasm. That's it. If you lasted 3 hours and they didn't get the orgasm, they're just going to be sore and hate you. Good for nothing. If you last too quick and then you come long before they are done, they're still going to be angry with you. So it's all about that. It's a relationship. Remember, relationship. That's what it is. So you need to find out what does the other person want. And once you guys get to figure out what you want, it's quite easy. It solves a lot of things, and they can identify where there are problems, and then they can consult for help to be to get help on that issue. But to go and follow the story that no, if you take a piece of this bean, she's gonna know exactly who you are. One of the side effects of doing that is this. Medically, we haven't seen a lot of stuff that I can say because of 1, 2, 3, this thing will kill you. But sometimes people end up taking even anabolic steroids unbeknown to them. Stuff that is mixed up. They give you something from a mug to drink. You don't know what is put in there. And then some of those things you may be kind of like doping, steroids. That's what it could be. But equally, if now you are going to reset the tempo in the house, your partner is going to get used to you at this level of performance. Meanwhile, this is superficial drug boosted. The next time you have not taken it, there will be a gap, a perceived underperformance. So you want to reset the tempo that you are this guy who never stop, you better sustain it for life. Because the time you are no longer functioning there, it's going to be expected of you. But if she knew that you performed that well this day because you guys had taken some stimulants and you wanted to be crazy, she will also know, right, it was just that once off. We were being silly. Let's go Viagra's and see what we can do and binge. You were binging. So the next time you're not lasting that long, she don't expect you to last that long because she knows this is you and this is you under the steroids. And definitely that's what it is. So I'm not for, okay, let me just go punish her.
Sure.
You hear that a lot.
One try like
ya go monta. Yeah, get la monta, tla ba mpita, tla ba bua se gerika. Make us talking, speak in tongues. At the end of the day, for everyone else, when it's coming to that, it's all about did or did they not get the orgasm, and how that orgasm come about. That's why I say 10 fingers, a tongue, feathers, toys, whatever goes for you. But a big but. It must be to the comfort of everyone else.
Sure.
Yeah.
Sure.
And then also maybe a plea within other institutions that, I've had people complain that doing something like that is going to send them straight to hell. And I'm not questioning anybody's religion or anything. But if a patient now is going to come to me to complain about premature ejaculation because they're so afraid and they feel so guilty because they had sex before marriage and now they're afraid that they're going to go to hell. They probably must also be within institution that preaches or teaches certain ways to also have an accommodation for people who might have fallen foul of such a system to be helped so that most of them can be fine.
Yeah.
I think the last thing, because now we probably ran out of time, I will say is that I saw a young couple, and this is a true story. They were from Limpopo, now based in Pretoria, born again Christians. They lived together for a while and managed to say, okay, they work hard trying to save money because one day they will get married, they love each other, and then the priest or priestess can give them the blessings to, do the deed.
Wow.
Mother Nature is Mother Nature. Something happened before the marriage. They had sex before.
Wow.
Now, these very same people who were all virgins had sex before somebody tell you, now I declare you husband and wife, lived with this guilt that now they had a dysfunctional sexual relationship.
Wow.
And they ended up with the doctor because they are afraid to tell them at church, fear of judgment, that you bloody sinners. So nobody's perfect.
Yes, sir.
And nobody's is supposed to change whatever they want to believe in. It's for them to believe in that. But within the systems, it must have a way to capture the outliers also, so that they can be put, because the issue of sexuality is very complex and also very psychological. So if somebody feel like I've done this and because of this, I've committed such an unforgivable offense, every time they try to do the deed, they are reminded that, when you ate the apple before it was given to you, and problems. And before you know it, they are under lots of medication. All what they need is maybe to kneel and be prayed upon.
And that's it.
That's it. And they'll be fine. Viagra for life. Hallelujah.
Sure.
Yeah.
Natural Viagra for life.
Absolutely.
Well, Dr. Ijane, I had a fun chat with you, man. I want to do this maybe sometime again. We'll touch back on this topic, maybe expand it a little bit further.
Now, most welcome. What we can do next time, we can probably pick up a specific topic and go into the depth of it as opposed to a more generic talk. Once in a while, we can, something like that, maybe around when winters approach, are there benefits to do circumcisions? When can it be done?
Definitely.
Men's month, okay, we can go into the greater details of prostate health, prostate care, prostate surgery, what could be done, how people can present. So you can pick a topic and then go into the depth of it.
Sure. Because
it was more of an overview and just a general talk today. Yeah.
Man, I appreciate your time, man. And thank you to Lebo for organizing. And thank you for welcoming us to your beautiful office, man.
Okay. No, thank you, guys.
Man, peace and love, guys. It's been another installment of Manned Up Conversations. Catch you on the flip side.